So this is the last in the series of vitamins and minerals. I'm going to talk about supplements. Some of you indicated that you were interested in supplements at the beginning of the semester, so I hope you find this interesting. The supplements industry is a billion-dollar industry, multi-billion-dollar industry. And whenever there's money involved, you need to beware because there are people who will try to use people's fears about deficiencies or disease to make money. Supplements are not necessarily needed or usually needed unless you're not healthy and you're not consuming an adequate diet. Now, there are some exceptions. A lot of people would benefit from a vitamin D supplement because it's hard to get that nutrient from the diet. And a lot of people would benefit from an omega-3 supplement if they don't eat fish at least a couple times a week. I'm trying to figure out why that corner is getting dark. I know the sun is setting. So who may benefit from a supplement? I'll give you a second to think about that. Seconds over. People with a low food intake, less than 1,200 calories a day. If you consume less than 1,200 calories a day, it's really difficult to get all the vitamins and minerals you need. Let's see. People who are elderly with poor appetites. Let's see. I'm trying to get that dark spot out. People who are elderly with their aging digestive tract, they may have difficulty absorbing nutrients anyway, but if they don't have a good appetite and don't eat enough, then they would benefit from a supplement. People with certain illnesses, I think of liver disease, folate helps regenerate the liver, for example. People who are strict vegetarians, especially vegans, at risk for B12 deficiency, zinc, iron, calcium, as we talked about before. Pregnant women are usually put on a prenatal vitamin that contains folate to prevent neural tube defects. And because their iron needs are so high, iron is usually included in the prenatal vitamin along with other vitamins and minerals. People with low intakes of certain nutrients should take a supplement of them, or people who have deficiencies usually need a supplement to replete. So when do you take your vitamin? I get asked that a lot. Generally, it's best to take vitamin supplements with food because there's factors in foods that increase the absorption. For example, there's a factor in meat, fish, and poultry that increase iron absorption. Vitamin C increases iron absorption. Fat increases the intake of fat-soluble vitamins. In fact, there's an interesting study that was done that looked at vitamin A absorption in salads that were dressed with regular salad dressing or fat-free salad dressing, and the vitamin A was absorbed much better with the regular salad dressing compared to the fat-free. It's best not to go overboard on any one supplement. We talked about this before. When you consume excess amount of one mineral in particular, we talked about that. If you consume excess of one mineral, you won't absorb as much of other minerals. It was my finger that was causing that shadow, sorry. So, excess vitamin A, we talked about the toxicity of vitamins and minerals. Excess vitamin A can cause bone loss and hair loss. And there's actually quite a bit of evidence now that excess intake of vitamins E, C, and even A can have an adverse effect on calcium risk or cancer risk. They were doing trials on antioxidant supplements thinking that they would reduce cancer risk, but they had to stop those trials because they found out the people that were in the supplement group actually were having increased incidence of cancer. So when we talked about regulation of vitamins and minerals in the body, we talked about the fact that regulatory mechanisms can be exceeded. The body tries to help us, prevent toxicities by reducing absorption and increasing excretion if the nutrient is water soluble, but that regulatory mechanism can be exceeded. And as a reminder, toxicities are more likely to occur from oversupplementation than from food. So the types of supplements, general multivitamin mineral supplement that contains no more than 100% of the RDA for the nutrients listed, and they will be listed on the label of the supplement. That would be the supplement that would be recommended that people take as an insurance policy. Prenatal vitamins do not always contain all of the vitamins and minerals that meet and in the amount that meets the RDA. Some people tell me that they take prenatal vitamins because they think it helps their nails and hair, but that's not true. Okay, so again, foods provide a variety of supplement, and they have absorption factors that are not in supplements. And in fact, we've found that vitamins and minerals in food form do not act the same way as they do in supplement form. For example, a vitamin A in cancer study, they found that people with higher vitamin A intakes from food had lower risk for lung cancer if they smoked. Well, so they did a trial of vitamin A supplements on smokers and found out that the vitamin A actually increased cancer. So the supplement did not act the same way as it did by itself as it does in food, because nutrients interact with each other in a way that can make them act in the best for our health. Here's an example. Phytochemicals in blueberry keep antioxidant vitamins in their most active form. So non-nutrient supplements, probiotics, there's a great series of videos that I put up on Blackboard. But remember, we talked about them before. They're the microorganisms that are healthy in the digestive tract. They enhance the health of the overall digestive tract. But they also enhance the immune system. So again, we're all concerned about our immune systems right now. So probiotics are really important for that. They have an influence on appetite regulation, glucose absorption. Let's see. And you know, we're at the beginning of our understanding of probiotics at this point. You can get them from food. Or from supplements. I'll talk about that in a second. One of the issues with testing the amount of probiotics, the quantity of probiotics in supplements, is that probiotics do die. So when they test the amount of the probiotics that are in a supplement, that's probably not the same amount that they have on the shelf. What you want to do when you buy a probiotic supplement is look to make sure that it is regulated. Look for a symbol called USP. That stands for United States Pharmacopoeia. That's an indication that the supplement has been evaluated, and make sure it's not past the expiration date, and keep them in your refrigerator so that the microorganisms will actually live longer. Yogurt and fermented foods. Now, fermented foods, if it's like pickles and sauerkraut, needs to be the ones in the refrigerated section. If they're canned, the heating and the canning process will kill them. Okay, so the way that probiotics work is they stick to the digestive tract wall, crowding out room for other microorganisms. So the harmful microorganisms don't have room to infect the intestinal wall to cause infection. Probiotics also secrete substances that kill harmful microorganisms. They secrete short-chain fatty acid that have a number of benefits, including fueling the cells that line the digestive tract. And then there's prebiotics. Prebiotics are the food that enhance probiotic growth, like soluble fiber and something called fructooligosaccharides. So I did put that video thing up. Now, as far as regulation of supplements, there was an act passed in 1994. The FDA does not regulate the supplements. They're classified as foods, not drugs. So there is no regulation that they have to be shown to be safe and effective before supplements are put on the market. They once people start complaining about symptoms, the FDA will actually investigate and may take them off the market if they can prove that they're not safe and effective. Let's see. The claims can involve a functional statement, but they can't claim that they treat disease. Quality control is not necessarily regulated, and what's listed may not be in the product, and that's been shown to be the case with a lot of supplements. So the FDA can't keep up with all the products that come on the market. So products that make false claims are often on the market for a period of time before the FDA regulates them. The risks are often not known because they're not regulated before they get on the market. Okay. There are impurities in some. There were some impurities found in some supplements in California. They were contaminated with lead, arsenic, and mercury. They do cost a lot. So dietary supplements are considered over-the-counter, not regulated, considered by most to be safe and natural, but that's not necessarily the case. So again, I'm referring you to the Linus Pauling Institute for more information on supplements.